I ask these questions because if you walk out of here this morning after the hour that we have together and you're not changed and you don't have a sense for how you might do things differently, then it's been a waste of your time and a waste of mine, and candidly, I'm not into wasting anybody's time. Albert Einstein said the best definition of madness is to keep doing things the same way and expect different results. You want different results, you got to do things differently. The hospital's not going to change unless you change. Ancient Zen saying, you move a mountain one stone at a time. You move a department one person at a time. You move a hospital one department at a time. So that's where we're looking, where we're talking about. Now, 1998, I was sitting with a nurse colleague of mine, and we said, let's be really outside the box, revolutionaries here, true innovators. Let's go to our staff and say, we want every workday to be satisfying and fulfilling. So we're going to ask you at the end of your day to rate your workday on a 1 to 5 scale. 1 not worth it at all, and 5 fabulous. And if it was a great day, please say why, because we want to try to make sure you have more of the same. And if it wasn't a great day, please say why, because we want to try to prevent that from happening to you again. And so this is a form we came up with. And we'd bring it out, we'd pull it out, and for 2 weeks we'd ask people at the end of their day to fill it out. And it gave us some hard data in terms of how people were feeling about their work experience. Because make one thing clear, this talk here this morning is not about patient satisfaction. We will talk about patient satisfaction, but the way you get great patient satisfaction is to create a great place for people to come to work so you have the team that gives the care. So let me ask you, think about either your last full workday, rated on a 1 to 5 scale. How many of you would give your last full workday a 5? Raise your hands. A couple. How about a 4? Raise your hands. Many more, a lot of 4s. How about a 3? Raise your hands. A bunch. How about a 2? Raise your hands. Yeah, a couple. How about a 1? Raise your hands. Any ones? Okay, question. If you can't, the Press-Ganey survey where your patients are asked to give you feedback on the care that they received, they're asked on a 1 to 5 scale, where 5 is the best and 1 is the poorest. If you can't give your day a 5, how easy is it going to be for your patients to give you a 5? Answer, not very easy. Now, the other thing that this tells me, it tells me that there are things getting in the way of your having a great day and you're loving your work. And the truth is, this life is not a dress rehearsal. We spend more waking time at work than we do anywhere else.